Christal Parker, who is going to be sharing with us around physical wellness. And she knows just a little bit, okay, just a tinge. She know a little bit about it. With 12 years of experience as a family nurse practitioner, with most of her experience in the ER. That means she gonna get us together directly and stat, as they say in the ER. Okay, that means with the quickness. Okay, she is the owner of Savvy Beauty and Wellness, which is a med spa specializing in IV hydration and aesthetics with a mission for enhancing beauty and wellness for all. In addition to that, Christal also coaches aspiring nurse entrepreneurs. Who knew you could be a nurse and an entrepreneur at the same time? Christopher, tell us about it. She coaches aspiring nurse entrepreneurs on opening their own businesses and has created the community she wishes she had when she started out her business. So many of us do that, right? We start out with businesses out of our need, right? What we needed. And in her free time, she loves traveling. Come on, a good flight is always in order. And being with her family, which is her husband and her two baby girls who are 3 and 1. One of her favorite quotes is, "You are too cute to be ashy." And I know that's right. God does not want us to be ashy in this season, right? So I believe that that's not God's desire for us to be ashy. So let us know how we can say I'm good and well moisturized like a good Tin Man.
Yeah.
The stage is all yours, Christal. Everyone, please welcome Christal Parker to the stage.
Hello, everyone. I am so happy to be here, so honored to be here, not only to be speaking to you guys, but also to be getting poured into as well, because community is so important. These speakers have been amazing, and it all segues into what I'll be talking about today, which is aesthetic treatments that we can get to enhance our beauty, which helps us feel confident, helps us step up to be a leader, as the speaker talked about earlier, how to have your brand and promote yourself. So I'm just going to do a little presentation. Hopefully I can move quickly here. So yes, too cute to be ashy. I have let's see if I can, there we go. Okay, so a little bit about me. She already said a lot. Our host, owner of Savvy Beauty and Wellness, which is here in Rancho Cucamonga, California. I spoke this year earlier at a big conference for aesthetic providers, and that was on diversity in aesthetics, because that is something that is near and dear to my heart. There's a lot of treatments we can get to make ourselves look and feel beautiful, but a lot of times women of color do not either know about these treatments, or we are nervous and scared, and it's a little taboo in our community. So again, Jesus lover, wife, mom of 2 girls, is ages 3 and 1. I also have a podcast, The Nurse Boss Shift, in which she mentioned I help nurses start their own businesses as well. So melanin makes you beautiful, as we know, but rest and self-care make you whole. So self-care is non-negotiable. I just want to remind us of that. So what is aesthetics? Aesthetics is aesthetic medicine that comprises of medical procedures that are aimed at improving the physical appearance and satisfaction of the patient using non-invasive, meaning non-surgical cosmetic procedures. So I just want to talk to this about, because when we are trying to build ourselves up and gain the confidence to go out there and either start our businesses or start our nonprofits or help other people, it always helps if we feel good, because when we feel and look good, I feel like we perform better. Okay, so services I offer here, and I only say this to say there's a lot I could talk about with this, but we only have a little bit of time. But I do offer Botox, filler, IV hydration, microneedling for the face with and without PRP, and exosomes, which are stem cells. I offer hormone replacement therapy, weight loss solutions, hair restoration, PDO threads, and I have an esthetician here on site. But today we're going to talk a little bit about 3 of my favorite treatments, and to give you guys a little insight and education so you can possibly go get service yourself. So as we age, fat, bone, collagen, they start to decrease. Okay, over the age of 35, the number of bone regenerating cells decrease rapidly. So as you can see in the pictures here, from 35 to 45, this patient has stronger muscles. But as we age, as you can see, the fat gets less, the bone isn't there, and we start having that sagging look that we see in the mirror as we get older. So they always say black don't crack, but we do wrinkle. Women of color don't crack. Our skin doesn't crack. It stays supple and hydrated for a long time, but we do wrinkle. So in that case, then we have what's called Botox. Botox is a brand name, but everyone knows Botox. So there's a lot of different type of brands, just like there is soda, but just like Coke and Pepsi, people know those. People are familiar with those. So commonly asked questions, areas that can be treated with Botox, and what Botox is. It is a toxin that goes in and it basically cuts off the chemical responses, which makes your muscles, it doesn't respond to your muscles, so your skin stays smooth and we don't have those wrinkles. So when you put on makeup and you smile, or your forehead wrinkles, you see those cracks and things, we can get rid of that with Botox. So areas that can be treated: the face, the neck for neck muscles, masseters, which are if you grind your teeth at night, you can get Botox in your masseters so you stop grinding your teeth at night. It can also prevent headaches and things like that. You can get it in your armpits and the palms of your hands, and also your edges for sweating. Also the nose, if you sweat a lot on the nose, we can do a little Botox on the nose and it actually stops sweating. You can, I said the neck muscles already. And then also if you have small little lines, smoker lines, they call them, above the lip, we can do some Botox to get rid of those lines, and also to give you what's called a lip flip, which the lip flips up. If you find that you smile and your lip hides, you can do a little Botox to bring that lip back out to show. Okay, it's never too late to start Botox, okay? But if you start early, late 20s, then the more you do it is preventative. So by the time you get 40, you probably only have to go for a treatment once a year. Okay, you want to research an experienced injector. This is not the service to Groupon or get deals on. You want to find someone who is experienced, and that's how you prevent either looking frozen, that people are scared of, or having complications, okay? We allow for 21 days for things to settle. With tox, the results last 4 to 5 months. Typical cost of treatment is $400 to $1,200. It's a 15-minute treatment. Potential side effects could be temporary bruising, swelling, and redness at the injection site, but those usually go away in a few days. So these are some examples. As you see on the left, there's forehead wrinkles. It's now smooth. In the middle picture, you see the crow's feet. We smooth those down so there's the lines around the eyes. To the right is another picture of a smooth forehead. In the middle, at the bottom, I show a patient who has what we call the 11. So if you frown and you see those 11s, Botox can smooth that right on out. Okay, next is skincare. I can do everything I want with the Botox, have your skin looking smooth, but that's just icing on the cake, okay? Skincare is very important, especially if you're the age of 30. Please do not use grocery store skincare for your face, okay? I do sell and recommend medical grade skincare, but you don't always have to have, medical grade skincare. But I do sell ZO products, which I really love. So as I said, they can only go so far, and I treat my self-care routine my skincare routine as my self-care. When I do my skincare in the morning and at night, I have affirmations on my window, my I am statements. I put them up there. That's 15 minutes where I lock the girls, lock my kids out of the room, and I do my skincare and I quote my affirmations for the day. So you can kind of make that, your ritual in the morning. And I always like to add that Vaseline and cocoa butter do not count as skincare. We cannot use those products on our face and expect our skin to stay good, because these are different toxins and environment we're living in. So just as a basic skin washing routine, so you have face wash first, then you want to use a toner, then you want to use a serum, like a retinol is good, a moisturizer, some vitamin C, and sunscreen. That's kind of the order of your skincare. Using those basic products will keep your skin looking nice and healthy. Okay, you basically put your creams and your serums on based by the thickness. So if you have a thin serum, that will go on first. Your thicker moisturizer would go on last. Okay, and this is kind of the same what I was talking about. You want to do lightest to heaviest. Retinol is great. Retinol is basically like Botox you're putting on every day, because it slowly sheds that old layer of skin, and it also reduces fine lines and wrinkles. Sunscreen is necessary all day, every day. Okay, if you guys don't know a good sunscreen brand, I personally use Black Girl sunscreen, and they sell that at Target and other convenience stores like that. One of my favorite new therapies is hormone replacement therapy. Okay, with BioT. Now, I used to think that hormone replacement therapy was only for older women, but as we age, again, by the time we hit 40, our hormones are half of what they used to be, okay? And benefits of hormone replacement therapy: if you've been feeling run down, your energy is low, your libido is low, you have brain fog, all those different things are probably because your hormones are lacking. Okay. If you go to your doctor, they will tell you, if they run a panel of your hormones, they will tell you your hormones are perfect. But there's a difference between your hormones being within range and your hormones being optimized. Okay. So with BioT and hormone replacement pellets, we are able to optimize your hormones. So some things that I have, since I've gotten pelleted, have gained. I have better energy. I sleep better. So not waking up in the middle of the night, tossing and turning. Also waking up refreshed, which is another issue. I've been wanting to be a part of the 5 a.m. club for months now, and it just wasn't happening. But once I got pelleted, I'm waking up at least 6. Okay. I'll give myself 6. I'm waking up at 6, refreshed, ready to start the day. Libido is better. Sex is better. I mean, you can't lose with hormone replacement therapy. So yes, let me go here. So my quote, yes, I am good enough. Am I good enough? Yes, I am. And I add that quote because we are all good enough just how we are. But if you want to make little enhancements, small adjustments, then you can do that with aesthetic treatments. Don't be scared of them. Just research a really good provider in your area. Here's my social tabs where you can follow me, and I'll see if we have any questions. I went through that really quickly because I was scared I was going to be in time. So
That was absolutely, child. You was like, let me give you the information. Okay?
this talk is like an hour, but I tried to speed it up. There's so much to know. But
Absolutely.
share a little Botox and some hormone replacement.
Yeah, child, you gave us the good holy trinity. Okay, said okay, these is the number 3 things.
Yes.
Okay, that you can use. I really one of the things for me, one of the things that as a part of my expansion journey has been around pleasure, right? So hearing you say with the hormone replacement therapy, and I know that that is an issue, right? For so many of us women, we are not experiencing pleasure, right, at the level, dimension, astral plane as at which we should, right?
Yes.
And I am a believer that God is concerned about our sexuality and our sensuality, and God is the God of orgasms. If you're not having orgasms, in my opinion, you're not in the will of God. I'm sorry, I ain't trying to be all up in your business, but I'm just saying that's how I have come to be with that. And so God is the God of pleasure. That was so good. Thank you for giving us the proper order, okay, of how to put the things on, okay, because I did not know that.
Yes.
I learned something new. I hope y'all took notes, okay,
Yes.
because I got my list together, and I also know now don't use drugstore products, okay. Oh my God, I learned so much. And so one of the questions that I have is regarding that regimen, right? For so many of us women, we probably have been using, right, drugstore makeup. We use and what we saw our grandmothers use, our mothers use, right? And it might not be the best products for our skin. And so if we're not local to you, what types of places or what type of professionals would we be looking for to support us in building our regimens?
Yeah, so a good esthetician. So esthetician with an E are women or men who do facials, things like that. It's good to always have a facial so they can evaluate your skin, let you know what you need. They also sell really good products. So any esthetician or what was my other thing going to be? Or going to a nurse or a med spa that specializes in skincare as well. So that's always good. I am open. I do have virtual consultations. So if anyone wants to schedule a virtual consultation and kind of want to go through what their concerns are, then I can definitely do that. And we can talk about it that way.
Fantastic. Thank you so much. And then we have one more question for you. For those when some people hear medical grade, right? That really like they think dollar sign, dollar sign, dollar sign. And so for those who are on a budget, how can we do a proper skincare routine on a budget? What would be your top tips?
So I would definitely just say at least if you have the order that I listed, a face wash, at least a good moisturizer, a toner, because what the toner does, and you'll see if you wash your face and then you go after it with the toner, you'll see how much dirt we don't get off with face care. So having a toner is very important, and also a good moisturizer. Water is very important. So those are things you can do, and you can use those drugstore products. And I shouldn't say that. That's being me. But with medical grade, you get there faster. Okay, so with medical grade, we can turn that skin around in 2-3 weeks. Okay.
Okay, medical grade is the express train.
Exactly.
That's it. Okay, got
Yes.
you.
Oh, and I also forgot sunscreen is very important, especially if you have hyperpigmentation, which I do. Wearing that sunscreen prevents it from getting darker and actually prevents it from coming in the first place. So definitely a sunscreen and water, and you'll be good.
Awesome. And for us melanated folks, the melanin is not the sunscreen. Okay, you need the
Yes.
sunscreen, right? Because a lot of us think melanin is, is
And I
the natural sunscreen.
used to think that too, and I do use drugstore black girl sunscreen, so that's perfectly fine. I just find that it doesn't give me that cakey sheen that some other sunscreens give you.
Fantastic. Well, thank you so much, Christal. You can follow, as has been stated previously earlier, you will, if you register for the conference, you will be receiving a digital resource with all of the contact information for all of our speakers. And if you're here live now, you can follow Christal at, Christal, can you give them your IG
Yes,
at?
so it's Christal P Beauty NP on Instagram. So CHRISTAL P as in Parker, and then Beauty NP as for nurse practitioner.
Christal P Beauty NP
Yes.
on IG. Thank you so much, Christal.
So welcome. Bye, ladies.